I'm going to tell you, folks, the coronavirus thing, there's so much hysteria out there, so much upset, and I understand and agree that it's a serious disease. It is not something we should take lightly. It is not something we should just be marching out life as usual and have a handshaking party with every stranger we meet. That is not what we're going to do. But we also have so much acrimony in this country, so much hatred of President Trump, so much determination to use anything that occurs as a basis to attack the president. And this is what is happening with the coronavirus. We're going to have on the show on Thursday of this week, we're going to have a gentleman who's going to give us much more detail from a strategy point of view about political warfare that is engaged in by the left and how the left is using the coronavirus as political warfare. It's important to understand it and label it that. This is not just the left trying to take cheap shots because they got a chance to do it. But I want to share with you on coronavirus some steps of progress. First of all, even the World Health Organization, which is, of course, concerned about the spread, keeping track of data, sharing data, letting people know what's happening. The World Health Organization put out information for the world to understand that in this entire planet, the entire planet Earth, well over 7 billion people. I should have looked up the exact number of them. Well over 7 billion people. We have 127,000 cases of coronavirus in the entire world. And of those, these are known outbreaks, so there may be more undiagnosed. Fair enough, maybe more. But how many cases of coronavirus do you think that have been diagnosed which involve people who have completely recovered? Got over it like a bad flu. In fact, the stories we talked about a couple of weeks ago or so, it's 7.8 billion people in the world. And so we have 127,000 cases, and the coronavirus is, spreading or has been spreading, and people are alarmed. But I want to spread this number the World Health Organization put out. Of the 127,000 cases in the world, over 70,000 cases are people who've completely recovered. And I think it's important to put that information out, not to put it out for the purpose of saying, hey, it's no big deal, just like having a cold, because it seems to be far more contagious, to be spreading more easily. I'm not advocating ignoring it. I am wanting to provide a balance of information against what the left puts out, which is endless fear-mongering, endless finger-pointing, fear-mongering, anger, denouncement. And we're going to talk also on Thursday. I'm going to run through on Thursday with you a litany of the lies the left has put out that the media repeats. People, the experts who are just Facebook people, who were last week experts on immigration policy, the week before they were experts on tax policy, and now they're experts on coronavirus, and they're just people sitting home in front of their computer grousing and trying to make the claim that coronavirus is just out of control, we're all going to die. It's important to understand good news too. Yes, we've had deaths from coronavirus, and I'm very sorry. I don't want anyone to pass on. I understand. I don't want people to die of coronavirus or anything else for that matter. But 70,000 people out of 127,000 have had a full recovery from coronavirus. So that means the stories that we've had in America, like I shared, or around the world, I shared with you, I think last week, for example, the gentleman in Denmark, the country of Denmark, who said he'd gone down to northern Italy, where the problem is huge. I'll talk about that in a moment, why. Problem in northern Italy was really bad. He went back to Denmark, started not feel well, got tested, had coronavirus. He said, I've had colds that felt worse. I've had flus where I felt more sick. And he was in his mid-40s. And he said, I'm fine. I'm all better. The point is to recognize that this is a flu virus, and we'll ultimately get to the question of how it got released in China, what level of wrongdoing we can attribute to China for the release of the coronavirus and for the failure to share the information. But 70,000 people have recovered. There are wonderful stories all over this country. People just saying, hey, wait, before we all get too carried away, I was diagnosed. Yes, I had these symptoms. Yes, I was uncomfortable. Yeah, I didn't like it very much. But I got over it. I got over it like I got the flu, 3 or 4 days in bed, and I'm done. The point is, people do get better. They recover. We have this in some quarters on the left in our country, and really maybe on the right too, but we have people just so determined, this is it, the world's going to end, this is the death of all of us, we're all doomed attitude. We need to not have that. Part of fighting coronavirus is fighting the panic, is fighting the unjustified panic, fighting the unjustified fear. So I wanted to share that number. 70,000 already in the world had recovered. In fact, you know what? It was an update. I'm sorry, I printed this story out. An update by Johns Hopkins that now 73,000, more than 73,000 people in this world have recovered from the coronavirus. So people do recover. We still should be careful. We don't try to spread it. We're careful to try to avoid spreading it and all the hand washing and social distance. But we need to have a bit of calm. Next point I want to make about this is kind of good news coming out of coronavirus, and that was that the country of South Korea, not the communist country, the actual free country that acts more like America. South Korea put in place the kind of same policies we're putting in place in America to stem the spread. They were having a problem too in South Korea. And I want to tell you guys, by the way, I'm sure and share before I get off this topic. In fact, I'll tell you right now, the reason in northern Italy that the coronavirus became so extreme, became such a problem, was that it's the fashion industry, which is headquartered in Milan in northern Italy, and many Chinese workers work in the fashion industry. They go back and forth to China, regular travel, before the coronavirus was understood. So they're carrying the virus back and forth, picking it up in China, taking northern Italy. That's how it spread there. And this is not to blame any person, but just to say there are reasons for these kind of particular concentrations. In South Korea, they were having a big problem. But the great news the South Korean president put out is that they have really turned the corner in South Korea. I mean, yes, we have to be cautious and follow the precautions we're being told to follow and all of that. But South Korea is saying basically they reported that coronavirus recoveries, people getting over coronavirus in South Korea, are now outpacing new cases. They have more people announcing they've recovered than the number of new cases, putting in place policies just like we have in America. We need to resist panic. It is vital that we resist panic. Last kind of good news coming out of this coronavirus, and I would never want to say, oh, great news, we have coronavirus, but it is allowing some changes to be made in our society, prompting some changes to be made in our society. One is growing understanding that we need to bring back the manufacture of medications to America. Currently, and we talk about this in the show, in fact, if you look through in our YouTube channel, wherever you watch this show, you can go back, especially on YouTube, it's easy to find our past interviews. We had an interview with Rosemary Gibson. She's the author of a book called China RX. It basically laid out her research showing that the large percentage of medicines we use in America, like when you show up at the emergency room or your doctor's office or your pharmacy, the medication you are given is overwhelmingly likely to have come from China. China deliberately captured the pharmaceutical manufacturing segment of the world's economy, deliberately set out decades ago to basically undercut American pharmaceutical and other pharmaceutical companies in this world, set out to make instead of making some real manufacturing by our pharmaceutical companies was occurring there, but China began making generics, and China began pricing those generics really low, assigning low prices. So obviously, people in need of medications, especially vast quantities, you can buy generics from China, and it's a far better deal to you than if you are buying the medications that is more expensive for pharmaceutical companies to have to manufacture. So China deliberately undercut America's pharmaceutical companies. China controls, creates, manufactures, is like over 90% of the antibiotics we use in our country, well over 80% of all medications, and we have had problems in this country already, even before the coronavirus, with medications coming from China that were in some way tainted. They don't follow the kind of protocols we follow in America, both with respect to inspections of those facilities by the government. Health and safety standards, it's just not the same in China. So in America, one reaction to coronavirus, recognizing we don't really want to be dependent long-term anymore on medications made in China, is we have both the president he's supposedly going to issue an executive order related to trying to bring back the manufacture of medications to America. And second, there's a bill introduced in the United States Senate by Republican Senator Marsha Blackburn. And actually, this was a bipartisan effort. She did the bill along with Bob Menendez, Democrat of New Jersey, and they've introduced a bill called Securing America's Medicine Cabinet. Okay, that's kind of a cute name. I like that. Securing America's Medicine Cabinet, SAMC. But there are basically various provisions in their bill trying to push manufacture of medications back to America. And one other point I want to make about that before I hit my last topic. We have in America benefited from the fact that we have foreign manufacture, not just of medications, medical equipment, toys, all sorts of our electronic gadgets, televisions and phones and computers, everything we need in everyday life, much of it is manufactured in China. And the reason is because it costs less to make things over there, because people are paid less than to make them in America. Part of the adjustment going forward in America in trying to bring back to our country the manufacture of vital things like medications and maybe other things too is going to have to be an adjustment that is kind of the ripples will go countrywide, consumers will feel them. If you start having non-generics, actual manufacture of drugs that are not generics by pharmaceutical companies, and even the manufacture of generics once the time has elapsed after the company that actually created the medication, they have some patent on it for a certain number of years. When you have generics coming out, ultimately, we may find that in America we'll have to pay more for medications. We just may have to do that. We may have to figure out how much we value having medications manufactured here. We may have to have Congress deciding how much more should federal tax dollars be used to support the research into development of new medications. Because the reason medications cost so much is because we have many regulations in our country related to before pharmaceutical companies can introduce a new drug in the market, they have to go through a lengthy series of tests and examination by our federal government. And that's, a good thing. I mean, mostly you want to have thorough testing before you're releasing new drugs into the market. But pharmaceutical companies point out they spend a lot of money in development, research and development. They may spend money in research and development and conclude, and they're testing that whatever they develop doesn't even work or doesn't work well enough. Other drugs do work well enough. So then they've spent all that money. The way they recover the money they spend is by the price they charge for their medications. And I'm getting around to saying that there will be arguments about, well, if we bring manufacturing of medications back to America, and medications cost more because we're not having inexpensive Chinese labor making these medications. Instead, American workers are making these medications. We're going to have arguments that talk about who exactly absorbs the cost of those increased medications. Is it just going to fall on consumers? Is it going to fall on the taxpayers through the government? Is the government going to help the manufacturers? And there will be all sorts of adjustments. And you know what? That's okay. It's okay. We have to have those conversations because the priority, in my view, the top priority is get the manufacture of vital medications back to America, get control of the quality of them back to America and the access to them, and then we're going to have to work out what happens to how we absorb the additional cost of these more high-quality medications manufactured by pharmaceuticals. The argument that Bernie Sanders of the world will make and the left will make as well, see, it's another argument for Medicare for all, another argument for socialized medicine. Let government control it all. We have to resist that. The last thing we need in this country is a government that controls the healthcare system, and they control the manufacture of medications and the choice of who gets medications. Once the government is in charge of the healthcare system and in charge of the manufacture of medications, they are in charge of rationing. They're in charge of who gets them. They're in charge. It will make medications more expensive the more government gets in the middle of owning the manufacture of those medications. It's a complex economic issue. I may get some expert in the show at some point to talk about it. I want to just say at this time in the middle of the coronavirus, it's a great time to wake America up to the idea we need to bring manufactured medications back to America. We need to deal with the increased cost. Perhaps we need to have different levels of approval that you can get from the FDA. Maybe the approval process of the FDA is too lengthy, unnecessarily costly. Maybe there are changes that need to be made there. We'll have adjustments to be made. But the overarching concern of the American pharmaceutical companies manufacturing medications in America with our standards in place, our quality tests in place, our inspection of facilities in place, those kind of things will be one of the good outcomes from this very unfortunate coronavirus. Bring all of it back here.